Hello, everyone. I'm Jason Tokarski.
And I'm Megan McGurman. Welcome to For the Love of Health, brought to you by Christina Care.
Do you know how to read your medical bills? Do you know what to do if you can't afford to pay your medical bills?
Today, we're breaking down Christina Care's financial assistance programs, and we're joined by Christina Care's Vice President of Revenue Cycle, Christina Corkery, and Supervisor of Christina Care Health Guides, Dawn Baker. Christina and Dawn, thank you for being here today.
Thank you for having me.
Happy to be here.
Let's start by laying some groundwork of how you're both involved in this larger initiative, in this work. Christina, coming from finance, I'm sure people assume finance sends the bills. But how is your team actively involved in helping people understand and afford their care?
So being over the revenue cycle here at Christina Care, our goal is to secure the reimbursement that's due to the organization, whether that's through an insurance payer or from our patients and the guarantors. One of those options is offering patients a multitude of ways to pay their bill. That may be through payment plans or other discounting, including the financial assistance program. So we have caregivers that are actively involved in identifying patients who may fit that criteria, who seem like they meet an additional need in addition to needing insurance coverage as well.
And Dawn, how do your team of health guides help patients navigate the finances?
As health guides, we help the uninsured navigate through Medicaid, the marketplace, financial assistance, and for those who don't have prescription assistance, we go through the manufacturer like Novo Nordisk or BI Cares. And we also have a Dispensary of Hope program here at Wilmington Hospital that gives free medication to patients who qualify.
It seems like a lot of people might be interested in what's available to them from Christina Care. Who actually qualifies for our financial assistance?
Our financial assistance is based on income. So depending on your income and household size, that qualifies you, may qualify you for Medicaid, the marketplace, and or Christina Care financial assistance.
So every January, the Federal Register publishes what the federal poverty guidelines will be for that calendar year. And then Christina Care has a very generous policy where we provide free care for those who are up to 400% of the federal poverty guideline. So it's again based upon income and then household size. I can tell you that 400% is very generous even compared to the other providers that are in our region.
And what is that number?
For a family of four, that can be up to $128,000 per year gross income.
Wow.
So you're saying a family of four making less than $128,000 can qualify for some level of financial assistance from Christina Care?
That's correct. Now, in order to qualify for our financial assistance program, there are some requirements, one of which is if you are uninsured completely, we will connect you with whether it's the health guides or other caregivers that we have in our organization to screen you for medical assistance. Our primary goal is first to get patients medical coverage, to get them insured so that they can take care of themselves for today as well as for future services that might be needed. If you happen to screen over the Medicaid guidelines in terms of you're making too much money in your household, you are still eligible for our financial assistance policy, which is again up to 400% of the federal poverty guidelines. Our financial assistance policy is also for medically necessary care only, so things such as cosmetic procedures would be excluded from that policy.
Christina, I feel like there's a lot of different terms going around here that might be confusing to people. There's the catastrophic coverage, and then there's uninsured versus underinsured. Can you give us a little bit of a primer on what those different terminologies mean?
Sure. If we have a patient that presents to the ED and then ends up being an inpatient and they have absolutely no insurance coverage at all, that is considered to be uninsured. Our first step there would be to see if they qualify for medical assistance and work to get them insurance coverage, also in line with the work that the health guides are doing on Dawn's team. If you have insurance, but perhaps you have an extremely high deductible or co-insurance or just a catastrophic plan, that's considered underinsured, meaning that you have minimal coverage and most likely could land with a very high out-of-pocket responsibility after your insurance processes your claim. We also have the term self-pay. So if you are self-pay, you may elect just not to have medical insurance at all. For patients who are self-pay and receiving services at Christiana Care, you will receive 15% off the total charges of your bill.
So let's say somebody is interested in this and needs some level of assistance. How do they apply for the program?
So as health guides, we meet patients during their outpatient experience at primary care or community health events, and we screen them, to see if they qualify. And if they do, we help them get connected to Medicaid, Marketplace, Screening for Life, and Healthcare Connections. And that's basically for the uninsured and underinsured to get cancer screenings and access to health care.
How do you find these patients? Do they ask for you, or is there a referral process?
It's a little of both. It's word of mouth. We work with Westside Health and LACC, and, we go over there and table, and they refer patients to us. The operator, we're great friends with them. That 733-1000 is our referral line from the outside world. We have an online platform that you can Google Health Guides at Christiana Care, and you can put in a request saying, I need assistance with prescription assistance, or I don't have any insurance, and we take care of that way, but mainly from primary care. We're embedded in primary care, so we see the patients at the time of their visit to get them connected to services.
I can speak for the revenue cycle. A lot of times patients don't really react until they have that bill in front of them. So a lot of our inquiries that we receive on the back end of after services have been provided is when the patient gets a statement. So once they do that, whether it's electronic or by paper, there's information on there that talks about payment plan options as well as financial assistance. There's a toll-free number that they can call. They can gather the information. We also have the application and requirements on our website.
Dawn, you mentioned finding a lot of these patients in the primary care setting. What if someone has experienced a medical emergency, is currently inpatient at Wilmington Hospital or Christiana Hospital, and knows they won't be able to afford this care without help? How can someone get ahead of it instead of waiting to call Christina's team after the fact?
Inpatient side, we have the acute care connectors who will send us referrals saying this patient is currently in the hospital and has questions or concerns about medical bills, and we'll take that referral and reach out to the patients.
I assume you've been through quite a bit of this in your career here. Do you have any stories or times that you've actually heard back from patients about how this process has helped them?
We have one patient who needed assistance with prescription assistance and had outstanding medical bills because she was going to the ED for treatment. So we were able to get her enrolled in financial assistance and also get her prescription assistance through BI Cares to get her medication. Because of those actions, we were able to kind of get her on the path. She was coming to her medical appointments regularly and not missing anything. Instead of going to the ED for treatment, she was coming to our primary care. So I think that's a win for us.
Absolutely. And I think that not only helps financially, you are really helping these people with quality of life.
Absolutely. We even have our own little food closet that I'm proud of. So they can come, without any questions, get, take items off the shelf and have something to eat as well. So we're proud of that.
Dawn, you've mentioned a number of different programs that these health guides help facilitate. Run us through some of that, because it's really not just financial. You just mentioned the food closet.
Yeah. We have financial assistance, which we help with, getting their taxes, getting their documents. We also do Screening for Life and Healthcare Connection. That's a state-funded program. Screening for Life and Healthcare Connection is a two-part program. The Screening for Life portion helps you with your cancer screenings, such as mammograms, colonoscopies, lung screenings. And the Healthcare Connection portion helps you get connected to your primary care. So you can go to your doctor's visit, you can get your lab work and get x-rays, on a sliding scale, but it helps you get connected to primary care without fear of a huge bill. Everything is based on income, so you know what you'll have to pay on the back end. Some people get free care. Others have to pay, but it's a minimal fee.
So Dawn referenced a number of programs that are available. I wanted to specify that at Christiana Care, our financial assistance policy is not sliding scale. So you're qualified up to 400% or you are ineligible. If you are ineligible, there's still payment plan options that we have for up to 24 months at 0% interest for you to pay the remaining balances.
We're talking about 400% of the poverty line, $128,000 for a family of four. There are so many people probably listening to this saying, I had zero idea that I, my friend, my neighbor, my sibling would qualify for that. Dawn, how do you make sure people know? How do you connect with the community to make it clear that we are helping so many people?
Our caregivers are committed to helping everyone that comes to our door to make sure they get connected to services, because it's so important, because you never know who your neighbor is and how you can affect them. So, you treat others like you want to treat your family members. Welcoming, no judgment. Let's get this done and taken care of so we can get you connected to services.
We offer a variety of ways for patients to reach out to us to start the financial assistance process. So you may prefer to do that in person at one of our hospitals where Dawn's team would reside. We have other offsite locations where we have team members that may assist. You can also apply through the portal on our website and get some information, or via phone and talk to one of our caregivers. Our goal is to make it as convenient and comfortable as possible for our patients so that we can continue to provide that service and ensure that patients are getting the care that they need.
We're here to help. We help everyone. So there's no shame. So reach out. If you feel like you don't have insurance, you can still come to the hospital to your appointments. We can meet you at the time of your appointment to kind of see and screen you to see which program is available for you.
Christina and Dawn, thank you so much for your time today.
Thank you for having us.
Yes, it was a pleasure. Thank you for having me.
Check the show notes for this episode to links to the financial resources we discussed with Christina and Dawn.
You can also follow us on social media. Just search Christiana Care on your favorite platform.
We'll be back in 2 weeks with another great conversation.
Until then, thanks again for joining us.
For the love of health.